Hello, everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. And once again, I am pleased to invite Dr. Rashid Chotani to the show. He is an infectious disease expert and also a COVID-19 researcher. Thanks again for joining us today.
Thank you so much to invite me and to talk about this very critical problem that the nation is facing.
Yeah, and Doctor, things just don't seem to be getting better. Let's talk about what's happening in the various states.
So, we've been looking at some states, obviously, California, Texas, Florida, Arizona. These were the hotspots. And what we're seeing is that, the numbers are slightly declining, but there's not a substantial decline in numbers, but they're much higher than what they were previously in the first surge of cases. And now what we're seeing is that the deaths are increasing in all of those states. And this is a huge problem. We've got about 4.6 million cases across the nation, and we've got about 156,000 deaths. And these numbers just keep climbing, and these are Americans that are dying. And it's a very, it's not a good situation, good place to be in right now.
Right. So what worries you most about the numbers and the trends that you're seeing right now?
So, to be honest about it, what happened was that there was a very good plan that was put together. It was an incredible plan, a three-phase plan, and different states took different type of, they just went their own way. They decided what they thought was the right thing. And we've talked about it. We've got to have a national strategy, which was given to the governors, to the nation. But some of them followed it, some of them didn't follow it. Even California did follow it, but I think what happened was that California, with all the precautions, let its hair down, relaxed. People just relaxed, and the folks that relaxed the most were the young ones, right? And they felt that everything is going to be fine. Now, if you take a look at the ethnic groups that are affected the most, there are the Latinos and the African Americans. And one of the things that you look at, if you look at Texas, Florida, California, in these ethnicities, and which is a very good thing, that they have a very close, tight family structure. So multi-generational families live together. Now, if somebody who's young is going out and not being cautious, not wearing masks, not keeping the social distancing, doing everything as things were normal, if things were normal, and going back home and then giving the infection to somebody at home who's much older, the parents or the grandparents, then the numbers are going to rise. And you take a look at it's just a major crisis right now. And and again, poverty or the socioeconomic status of the nation has to be looked at. The demographics have to be looked at, and you see that a lot of these ethnicities live in tight, close proximity, small, relatively small houses, and thus it's easy for the disease to transmit. Diseases love, infectious diseases love where people are living in close proximity, and a lot of people are living there. And multi-generational people are living there because it can skip from one person to the other. The young ones will not get diseases, but the older ones are really going to get affected. And the problem is that we just, in states and in certain counties, in certain cities, the hospitals are just not able to keep, take care of the burden of the disease in terms of the beds, in terms of ICUs. So that is where the problem is. And of course, you, myself, I don't think there's anybody in the nation who wants more deaths due to COVID right now.
Yeah, no one wants that. You mentioned a national strategy. We here at KTVU reported on a call by a number of health experts for a 6-week restart, a 6-week shutdown. Is that something that you think is needed right now? And by a 6-week shutdown, I mean the entire nation.
That's a very difficult question to answer, to be very honest about it. I mean, if we look at our economy and if we look at the numbers, we are in a very serious recession right now. We've never seen something like this before. And, there are some decision makers that are going to be worried about that situation. But we've got to also evaluate what is really going on in the nation. And I believe that it has to be a unanimous decision across the board where public health professionals, economists, and legislators are all going to sit together and come up with a plan. It cannot be one or two or five or three people. This has to come from the top. And this has to be unanimous, and everybody has to agree to it. And I believe that if everybody agrees to something like a 6-week or a 3-week or whatever the plan is, right? If they come up with a plan, things will improve. One of the things that we've already talked about is that if there was a national mandate, and we've seen data now for masking, and I'm so happy that even President Trump is saying that wearing a mask is patriotic, and if everybody was wearing a mask, then we would be able to decrease the burden of disease quite a bit.
That national shutdown is something that obviously is being looked at, but do you think that there is an appetite to shut down the economy once again?
To be very honest about it, I don't see an appetite. People are struggling, but if that is the only way out, this is, again, as I said, it has to be a unanimous decision. This is a very difficult, very, very difficult decision, because economy is going to be affected by it. There are a lot of people who don't know what tomorrow is going to look like, and with all the things that are going on, and so many different big companies shutting down or closing, even the small ones are closing. Businesses are just going out of, it's a tough question to answer. But to be honest about it, if there was a 6-week shutdown, complete shutdown, what would happen is that we would absolutely bring the curve down. There's no question about it mathematically. Let's be honest about it. Yes, we will be able to do it. But then again, one of the things that is needed is that even after 6 weeks, if we do that, there have to be certain mandates in terms of masking, social distancing, and hand sanitization, because that's the only thing that we've got right now in our arsenal till we get a vaccine. And there's some positive news about the vaccine, but those are the kind of things that we've got to be making sure that those things are happening. I believe that if we institute all of those things while we are making that decision, whether we're going to do a 6-week shutdown and mandate masking across the nation, things will improve even slightly. I would be very happy to see that the numbers going down.
Yeah, obviously the shutdown would be effective, but then it would raise the question of, okay, what happens after those 6 weeks, which you just brought up. I want to talk about something else that was discussed this week, and that is the idea of face shields, perhaps even goggles, in addition to face masks. Your thoughts on both of those things?
So, we've talked about it on the show before. When I go out, I'm wearing a face shield or goggles. If there are patients, if we are doing some testing, if I'm exposed in the clinic situation or wherever I am, to be honest about it, what is the harm in doing that? One of the important things to understand is that all mucosal surfaces need to be protected. And one of the things that most people know about, that eyes are open, right? It's the only organ essentially that has capillaries, and you see that when you get red eyes, right? You see capillaries. So those capillaries, the tiny vessels, blood vessels, they can actually absorb oxygen from outside and actually take the oxygen inside the eye by itself. So if it can do that, and the reason for me to explain it, and I apologize if people know about it, is that viruses, the kind of virus that we are talking about is so tiny, and it can easily go into the eye, and through that into the blood vessel, and then into your body. So if you are in a situation, the healthcare providers, and I tell all the healthcare providers, everybody that works over here, to be honest about it, has to wear a face shield, period, or goggles. We've got both of them available. Goggles are difficult, but face shields are not such a, there's a little bit of pressure on the head. Your hair doesn't look good, but hey, you've got to wear a face shield. I was wearing a face shield today, by the way. And it is not easy, but it does help. So healthcare professionals, people who are in contact with other people, for example, in fast food restaurants, right? Where if there's no shield, if there's a shield you already have, then it's a very good thing. But wearing a face shield is not a bad thing to do. A lot of businesses, by the way, have provided that. It is one of the most inexpensive items that actually can be made by yourself. It's not such, this is not rocket science. And if we can do that, then it's a very good thing. I think we should wear, especially when we are going to be exposed to a lot of people who we don't know, who are coming to our clinics or the hospital or to the labs or to any business that we are operating where we are interacting with a lot of people.
Okay. You mentioned vaccines. Let's talk a little bit about how things are going. We know that Moderna vaccine is now in this very important trial, testing a lot more people. What will you be watching for over the next coming weeks?
So, to be honest about it, it's a very promising thing. Two vaccines, the Moderna vaccine and the Oxford AstraZeneca vaccine, both of them are doing very well. There are a few other vaccines that are doing very well. There are 129 vaccines. There are about 26 on top of the food chain, essentially. But these two vaccines are going to the phase 3 studies, which is a remarkable thing. Now, as we've said that, we always have preclinical studies. After that, we have phase 1 studies, phase 2 studies, and then phase 3 studies, which is the final phase of the studies that we are looking at. We have to, and a large number, a few thousand people are enrolled in that study. It takes time to enroll those people. Everybody should understand that it's not like it happens in a day, but phase 3 studies have started. These two trials are beginning and enrollment has started. It will take time for doing all the enrollment, vaccinating all these individuals, then taking a look at the immune response of these individuals to see if there are any side effects that are occurring which were not seen previously, and then be able to evaluate it, do that data analysis, and carefully look at if this vaccine is efficacious, this vaccine is safe. What is the exact dosage that is required? Is it going to be 1 dose or 2 doses? Because we've had, we are learning right now that, that there's a tremendous amount of information that's coming in as far as the immunity process works. Now, we've noticed in Germany, a study just came out that is showing that there are people who actually have never been exposed to the virus, never had the disease essentially, and they were tested and they had some kind of a T cell response, which is something that we have in our bodies that it responded, and they were not getting they were getting a milder kind of disease because the body apparently had seen this kind of a virus previously. So there's still a lot more to be learned, but the vaccine studies are promising. And I am cautiously optimistic that by the end of this year, we will have something in our hand. The question is going to be who that vaccine is going to be administered to, number one. How are we going to administer those vaccines? And plus, what is the national strategy going to be to do mass vaccination? And then how are we going to be able to fight with all the people that are anti-vaccine folks, which is a lobby that is huge and a large number of people are already talking about it. How are we going to deal that? Because unless and until we have a massive vaccination campaign and people get vaccinated, as many as possible, we will not be able to develop herd immunity.
Yeah, you bring up a lot of very important questions there when it comes to vaccines. Finally, Dr. Chotani, I want to talk with you about this outbreak that happened at a summer camp in Georgia. The camp took some precautions, but there is some criticism that it didn't go far enough. This can, though, be a learning lesson when we look at the potential opening of classrooms for students in the fall.
You're absolutely right. This is, as we learn more and more about this disease, we are astonished as to how this disease propagates, right? Everybody that came, over 300 people who were, the folks that were running the camp, as well as the children, they were going to be, they tested negative, and there was a condition that you had to have a PCR test that's negative to be part of the camp and part of the staff. They were all negative. They came in. One of the things that was mandated for the adults who were, the staff, was that they had to wear the mask. The children did not have to wear a mask. Now, we have also learned just recently that children can transmit the disease as effectively, who are above the age of 10, as adults can, right? They will not necessarily get the severe form of the disease, but they'll acquire the disease and be able to spread the disease. Now, the question that the investigation is going to take a look at is was everybody tested, or was somebody not tested and they said that they were tested? Number one, that's the first thing that you have to take a look at. The other thing that we have to take a look at is that, when were you tested? Now, if I was tested a month ago and I was negative, or 2 weeks ago and I was negative, or 1 week ago and I was negative, in that 1 week, did I observe all the precautions? Now, if that is not the case, that I could have acquired the disease after I was tested. And if, hypothetically speaking, again, one can be you can be a quarterback after the game is done, right? And criticize and all that kind of stuff. But let's face it, if everybody was masking, right? And if they'd observed the social distancing mandates and a little bit more precautions were taken, so many people, almost, I believe 2/3 of the people in the camp after the camp was over tested positive. That means that the disease just spread like wildfire in that particular area, right? So that should be a lesson learned, that the disease is spread, can spread very quickly. And if you're not taking all the precautions, this can become a problem.
Yeah, yeah. I think a lot of people will be looking at that summer camp to find out the lessons learned before we move ahead with opening any schools or anything like that. Dr. Chotani, really appreciate it. Always appreciate your expertise. Thank you so much.
Thank you so much for having me, and stay safe, wear a mask, social distancing, and wash your hands or hand sanitize them. And till we meet next time, best of luck.